CORETV News, expanding your view.
Thanks for staying the course on the show this Sunday. Though it sounds like a wrestling bout, but the tango is real. NMA versus federal government, as medical doctors have been on strike for over a month now, especially in the face of the deadly Ebola virus disease. I've been on the set with the second vice chairman of the Nigerian Medical Association, Lagos, Dr. Segun Akinwotu. Thank you very much for staying the course on the show. We were talking about the issues, why doctors are on strike. I recall that as a core member in Benin, earning 5,000 naira monthly. I had medical colleagues who were earning close to 100,000 naira per month. What's this remuneration on the list of issues why doctors are on strike?
The doctor actually, is taking care of people. And for you to be mentally stable, for you to be fit enough to handle many patients, as you see, you need to be well enumerated. So you don't have to start thinking of doing other jobs. So you can stay focused on your job and be able to carry out and give your best to it. Now, you asked earlier of reasons why the strike has been on. There were a number of things we asked for. Some, yes, are doctors' demands, which are not primarily remuneration. Others are improvement of the healthcare system. The target of the National Assembly is to have universal health coverage by 2015 to 30%. Next year, 2015, 30% is unacceptable. We want universal health coverage, 100%. Nigeria is buoyant. Nigeria is financially endowed, and we can do this if the government has a political will. But it's looking as if our request is just seemingly what we want financially. The only aspects of our demands that are related to finances is not directly finance. We usually, over the years, we've had cause to have an increment or change in salary scale of doctors. And this goes pari passu that of the other health workers. Now, the doctors are paid on conmen scale. The conmen scale has certain amount of allowances with it. This was commenced in 2010. But unfortunately, certain aspects of it were deleted by the government, either deliberately or mistakenly. And those amounts of funds that were supposed to have come with it then did not come with it. This was since 2010. And when we now discovered it and informed the government last year, they said they will implement from 2014. We're supposed to go on a strike January 2014. But a circular came that government will implement the new corrected commerce from January 2014. They now said, sorry, when we pass budget. Budget was not passed till May 2014. When they passed the budget in May 2014, they said, sorry, it was not there, that we should give them some time. Given time, by the time they came back again, they said they will implement the corrected commerce, not a new salary increment. Because this commerce had been on since 2010. But there was an error on the part of the government. And okay, fulfill that part that was left out, the corrected commerce. It became a problem.
But what is this thing about?
Now they are saying 2015.
What is this thing about the federal government saying that it has signed, that you guys signed memorandum of understanding about twice, and of course insisting that they've met 90% of your demands?
See, let me tell you how it works. The enemy comes from various states in Nigeria. We have 36 of them. We have a meeting. We highlighted what we wanted for government to ensure it is met.
Okay.
And then we have our National Executive Committee, and then we also have a negotiating team that goes to government. How can those who have gone to a negotiating team sign a memorandum of understanding without coming to seek our opinion about what the government has actually acceded to?
Did they sign it?
We don't have such, we never seen such a document before.
But the federal government insists that they've signed certain memoranda with
you. The government said it has met 90%. And I've told you here today, even the little few, 3 out of the demands that have been met were not very correct. There were irregularities in them that are still unacceptable. Placing doctors as entry point house officers on conhes is not acceptable. It's not done. And at the same time, you've said certain, okay, you don't want other people to be given a nomenclature of, that is the office of the medical director remains but for those who have studied medicine in school. That's what you said. And somewhere along the line again, you also said, whether if someone else will get into that office, it's at the discretion of the Ministry of Health. They are conflicting statements. So even the ones you said you have talked about were not actually done. Then 75% of the things on that list for example, hazard allowance, which brings me to the issue of Ebola. We've been on strike for like 6 weeks, as you said. Ebola came in like 2-3 weeks ago, if you remember, right? The strike had predated any Ebola scourge. Ebola scourge is viral. It's an outbreak that is even trying to ravage many other West African countries.
No, an ordinary Nigerian would have thought that the moment we recorded the first case of Ebola in Nigeria, Nigerian doctors should have called off the strike. It's called the human face.
Yes, but what we're saying is this. With such a case, you don't really need all the doctors in Nigeria to manage Ebola case. In the ministries, both state and federal, there are doctors in those ministries who have the wherewithal and the knowledge to manage such outbreaks. There are epidemiological units in those units. But that as it may, NMA, as I said, has volunteered a number of doctors to this. In addition to the 2 foreigners who are managing these patients in the IDH in Yaba, 3 other doctors are members of NMA. We actually referred them to the committee,
Well,
and they are working there.
You agree that there are not enough medical personnel
There
as
are.
it is
There are.
now.
See, as at Thursday, this screening they are talking about volunteers. Many of my doctors are there. Many, several. I can just start calling names now because it's not very. So people may get scared of them even because it's gone to an Ebola area and then they'll get scared of them. These are confidential things. But the simple fact is that those who have come there, some of the NMA officials are there. We have an NMA Ebola committee. There's a national emergency response on Ebola. There's also EOC, you understand, on Ebola. These committees have been we're having several meetings with Lagos, NMA Lagos and national. Various states. You see, let me tell you something about Ebola. Prevention is key. And when we say prevention is key, the government who is trying to blackmail NMA now that we didn't call off should have taken a proactive step earlier. The minister has attended several meetings, West African ministers of health, when Ebola scourge started. He was at that meeting. And from there, he went to play in the United States. And then Ebola now reached Nigeria. That's why you should have come to take precaution. Look, from the Nigerian airport, anybody who has a symptom of this coming from social region should be quarantined.
Talking about the minister, because you made mention earlier, one of the reasons why doctors are on strike as regards some doctors being the medical directors of hospitals. The minister, for crying out loud, is a doctor and a member of the NMA. How do you justify what NMA is fighting for, even if a doctor, for instance, cannot stand for you, you know, with the federal government? But before that, we have a call from Ademola. He's calling from Surulere. Good afternoon, Ademola.
Good afternoon.
Let's go ahead with the contribution.
Okay, please, I have a question for the doctor on the show. Yeah, I want to ask the medical doctor these 2 questions. Is the medical doctor in Nigeria, I think, saying that there are super people in the employ of federal government, that no any other leader, no any other professions under the employment of federal government can hand as very close to their salary? That's number 1. I want to ask the medical doctor to also tell us that in Nigeria, you have a farmer that becomes the president of this country. Is it allowed? And in teaching hospitals, you have...
I didn't get your second question.
...by professionals, specialists. Why must it be a medical doctor to be CMT? Well, I said in teaching hospitals. Are you getting me?
Yes, go ahead.
Hello?
Go ahead.
I said in teaching hospitals, we have pharmacy units, we have nursing, we have laboratories that are being manned by specialists. Why must it be a medical doctor to be at edge? And the medical doctor tells us that other professions in health line, they don't have other stake in their own area. So why must it be a medical doctor to be the CMD of the teaching hospital? Why must it be a medical doctor to be the minister of health in Nigeria? Why must a medical doctor have more than any other person in the employment of federal government in the country? I want medical doctor to react to this question.
Thank you very much, Ademola. I'm sure that you got the question clear. Let's take it one after the other. Sounds like the question I just asked you. He said, why is it that the medical doctor is supposed to earn more than every other field, every other employment with the federal government?
See, the medical doctor actually if you look at it from the university days, the medical doctor is not just a straightforward, like a bachelor's degree. If you look at it, we spend 6 years, 7 years in our undergraduate, and then it's a specialized specialty from the beginning, in the sense that in other countries, the way they do it is you first do like a bachelor's degree before you can be allowed to do medicine. But here, we do the bachelor's, we do the same courses. The biochemistry, the physiology, the anatomy, which are done abroad. They do it isolatedly, and then they do the MBBS. You understand? And because they have the MD degree. But here, we do it at the same time. It's because it's not separated that you're making it look like it's 2 degrees. Ordinarily, the MBBS is already a postgraduate, if you look at it technically, because you've already had the pre-degree of physiology, anatomy, biochemistry. You do all that for like first 3 years in the medical school before you now go to clinical years in the 400 level. So you cannot now simulate it. That's why, check it. Any country you go to in the world, who earns most of the professions? Is it not the doctor? So why should it be different in Nigeria? If we begin to say somewhere outside the country, other people don't strike, it's because the environment is conducive to work, and then the remuneration is very, very tangible. But in Nigeria, it is not the same thing.
He also made mention that there are other fields like pharmacy, nursing,
yes,
who are also integral to the medical operation, as it is in Nigerian hospitals. Why should we have only doctors as CMDs?
I beg to ask. It's called medical director. In every medical team, as we work, in a hospital, when you go to see your patient, there's a medical team. We have the doctor, we have the pharmacist, we have the nurse, we have the laboratory scientist, we have the occupational therapist, and the psychologist. In that team, whenever we have the meeting, the doctor heads the meeting. It's just statutory. It's because the doctor has, as I told you, I said it from the beginning, the doctor has a clearer knowledge of all those fields. So doctor knows how to harness the hospital environment better than any profession, because we are more equipped to do that. So these are just simple antecedents. And this has been happening for how many years? Nigeria has been independent in 1960. Why is it that it is today that somebody woke up in the morning and realized we should head the hospitals? That's the question.
If I'm allowed to argue with you, I would tell you that some of us also who didn't study medicine spent donkey years in school. And every other profession is as important as medicine. For instance, you wouldn't be here if not for my profession. But that's just on the soft side. Let's talk about, I asked a question earlier about the moral justification. If, for instance, people are going to die, or if people have died already as a result of this ongoing strike, how do you justify that? Because you want a doctor to be a CMD, or you want more money to be paid to you as a medical doctor?
It's not because
relative to the oath.
It's not because we want more money to be paid. Like I asked you, the working environment is not conducive enough. There are certain things we require to work that are not available. There are certain equipment we need to work with in the hospitals. We said we want basic universal care, 100%, at local government, state government, and federal level. At all levels, we should be able to have equipment as obtainable in other hospitals in the world. That's what we are talking about. And that people should have universal accessibility to healthcare and basic health insurance scheme provided.
Should people die to make that point known to the government? Must people die as it is now? Because there are Nigerians who cannot afford alternatives.
That's why we are saying
in the name of private hospitals.
You see, the government...
Just a minute, doctor. We have another caller from Ado-Ekiti. Hello, Solomon.
Hello.
Solomon, you're welcome to Call Digest. Go ahead with the contribution.
Hello. Yeah, I want to ask a question from the doctor. Can I speak on?
Go ahead, please.
Doctor, do you want to tell me that the Minister of Health in Ghana, who read biochemistry, did not do the job? Do you want to tell me that in Gambia, where the minister is a nurse, health services is not going on in that country? I want to assure you that health services in Ghana, in Gambia, is more coordinated and better than Nigeria. Look at all the parameters, all the indices. So it's not necessary. I'm not saying that the doctor cannot be the minister of commissioner. Since the doctors are the commissioners of health in Nigeria, minister of health in Nigeria, we are cheap. Hello?
I'm with you, Solomon. Please go ahead.
It is that arrogance that is bringing the health services in Nigeria down. Please let's calm down. Let's calm down. Anybody could be. There have been a period when the minister of health in this country read French, Dr. Madou Boukwe. There has been a period in which Julius Adeluye's pharmacist was minister of health, and everything was working fine. There was fairness, justice in the treatment of all medical personnel. There was a time in which we have Professor this man from economics from WHO was minister of health. We have a problem in the health services. Let's calm down. The issue of price is causing us a lot of things in this country, and the earlier we address that, the better. Thank you.
Thank you very much, Solomon, calling all the way from Ado-Ekiti. Would you agree that doctors are arrogant and proud?
No, I don't. I don't agree to that. We are very modest. We are very, very modest. Doctors are not arrogant. But what we are saying now, for example, going by the issue of sacking of the doctors, you find out that the population of doctors in Nigeria already is inadequate. The patient-doctor ratio recommended is a 1 doctor to 1,000 patients. But currently what is obtainable is a doctor to 6,400 patients. And with this sack now, you're going to have a longer wait time by patients. So I wish to say it is very ill-advised and very untimely. Negotiations are means through which you solve such problems, not outright sacking of doctors.
Well, what is actually the difference between someone who's on strike and someone who has been sacked?
There's a difference.
Because the bottom line is that the medical personnel were not available for their job, and even now that they are sacked, they are not still available.
There's a difference because those who are working are specialists, mind you. Resident doctors in hospitals are specialists, not just medical officers.
Okay.
Now, if you sack that team that forms the majority of the doctors in the healthcare system, the system is going to collapse. When you're on strike, if the government is truly sensitive to the plight of the people and gives reason to what the doctors are talking about, the federal government should act swiftly to ensure that whatever will be done through negotiations are achieved.
Just a minute, Doctor. We have a caller from Asaba. Hello, Francis. Good morning, Francis. Good afternoon, rather. Are you there?
Yes, I'm there.
Please go ahead with your contribution.
Okay. Well, good afternoon, gentlemen, and I really appreciate your contribution. In as much as appealing to federal government to rescind its decision on the backing of Nigerian doctors, but I want to advise my doctors that they should allow other health professionals to attend to the peak of their careers. They should encourage other professionals to develop, because they are lording themselves over all the other professions, in the sense that they are suppressing the development of other professions in healthcare. And this will not go well for the country. So I'm appealing to NMA man there. He should call his colleagues to order so that they can encourage other health professionals to develop, because it will go a long way to save the life of patients, which they have sworn to take care of. So that's my appeal to him. Are you there?
Yes, Francis.
Thank you very much.
Thank you very much for your contribution. Francis came with an appeal to you to go on behalf, to appeal to your fellow professionals. But in this kind of situation, it appears as if there's not much cohesion between the medical doctors and other health professionals, because one of the reasons why you're going on strike is outrightly against other health professionals. How would you describe that relationship? Because a doctor
We
in and of himself cannot survive alone without the help of nurses, pharmacists, and others.
Yes. In looking at it critically, some of those demands are outrightly what we want. And if you look at, for example, there's what we call skipping. Skipping actually was an error, as far as we are concerned, that took place in the course of the years. From grade level 10, the nurses and other allied workers skip 11 and go to 12. And you agree with me that grade levels have remunerations attached and other perks and privileges. Now, you allow all these people to skip. And we've talked about this with the government for years, that we are in the same civil service. If they will skip, then let us also skip. Because what is good for the goose is good for the gander. But government had decided to turn deaf ears and allowed them to continue that skipping, while we are just made to go at each stage at a time. And we said, no. If you want them to skip at this level, the equivalent of that level on the grade level for doctors, let us, when we get to that level, let us also skip, so everything can be at peace. Government still, since last year, has been going back and forth. How have they answered these questions? Now, it's not as if we are deliberately trying to go against or not have a cohesive association with the other health workers. We work as a team. Primarily, we work as a team. But I wonder why there's an impression as if we are trying to truncate the growth of other doctors, other health workers. They have their unions. They have their various schools of training.
We have another caller, Dr. Adebayo from Owo. How are you today? Hello, Adebayo. Are you there?
Yes, good afternoon, sir.
Afternoon, Adebayo. Go ahead with the contribution, please.
Hello? Yes, I'm there.
Go ahead, please.
Yes, I'm calling from Owo. I work in medical records department. Can you hear me?
Yes,
Can you hear me, sir?
exactly. I can. Go ahead, please.
So I want to contribute to what Dr. Segun has been saying since all while. Actually, they have been trying to be economical with the food. Let me start from the issue of the head shift. As of 1985, it was the director of admin that used to head hospital. And it was through the agenda of all the health professionals that it was the issue was got from the director of administration and was beginning to all other health workers. The doctors, because of the position they occupy, they came in and the end is the one I got to do. So, since 1995, until our present, nobody had any quarrel with any doctor. But we now see that doctors are actually selfish. They are selfish. They only want their own alone. And when they bargain for issue of increase in work allowance, they negotiated with the government. They requested for 150% all allowance and paid other at 88%. That is as of 2001. So right now, if you want to solve the issue of the hospital, other health professionals have to be heading that field. Let me challenge you. He said he read 1 year he read part of lab, 1 year in laboratory, pharmacology business. Can he alone do all this work? Can he dispense? Can he manage? Can he run laboratory tests? Even their consultants, they are unable to run tests, not less than any other doctor. So, and again, sir, on the issue of consultants, go to England, go to America, go to Canada, all other professionals, they are consultants in their field. Let me remind you again, I said I work in medical records department. So no doctor can qualify in this country without passing through my own department. They will come here, we give them necessary materials for their research, even the resident of doctors. And the issue in regard to administration as of 2010 is not a mistake at all. They call it relativity. The meaning is this. A doctor that is employed 3 years ago, if he is on level 12, and I that am employed on level 7, I am 12 years before I reach that level 7, that level 12. The argument is that it should not take the same basic. We should take separate basic. If we want the husband to be more than high, not minding the number of the years before I reach that basic. Not minding the number of the years he or she, a doctor needs to reach that basic.
It's all right, Adebayo. I think that you made your point there. I think we should have brought you to the studio so you can have enough time to make your point. But you know, he actually said that it is obtainable in other countries that health professionals in other fields except medicine can also become consultants in their field.
I can tell you that that is categorically untrue. When you say consultant, I'm sure you're into media. You have media consultants. That is not an appointment by government.
Okay.
When a doctor has gone through his postgraduate and has passed the fellowship exams, and he becomes appointed by a tertiary institution to work as a doctor, then he's referred to as a consultant. Even a doctor who has just passed his fellow and is not yet employed by a tertiary institution to work as a doctor in that field, is not yet a consultant. So I don't know why people are having a misnomer. In the United States, as you claim, many of us are well-traveled. Pardon me to be very, very straightforward about this. They are referring to nurses who have agencies. They have agencies where they are able to send nurses who call off from shifts and replace. It's like a calling agency. The person in that office, she doesn't work with the government. When you go to, as a nurse to work in a tertiary hospital in the United States or in the UK, you are not a consultant. You work as a nurse. You have your nomenclature as a nurse.
It appears that you're not only at loggerheads with the federal government, you're at loggerheads with other health professionals. But I asked you a question earlier that we do not only have doctors as CMDs in Nigeria. As we speak now, the Minister of Health is a doctor, and yet he doesn't share your opinion. How do you react to that?
For various reasons. If a doctor chooses not to share my opinion, for example, there are doctors whose wives are nurses or whose wives are in other health fields. If the doctor decides to, the wife has spoken to him in the night and he decides to make his wife a consultant, those who did it in the past, they've gotten letters telling them to change that decision. And it happened in Ibadan. And they wrote a letter to the chief medical director that what he did was wrong. And he had to reverse it. So I don't know what we are talking about now. It was an error. If it wasn't an error, he wouldn't have been told to reverse it. So we're talking about other health workers. If you want to be a consultant, you want to have a consultancy firm, so to say, you move out of the hospital setting.
But what I'm saying is that the Minister of Health is a medical doctor.
Yes.
And he's actually a member of the NMA.
Yes.
Because you told me that
yes, a member of NMA.
earlier. So that doesn't justify the yearning to want to have a doctor as a CMD. Because if the minister doesn't share your opinion, the CMD as well or any hospital might not share the NMA's
I've not said
opinion.
the minister doesn't share my opinion. I've not said so.
But the NMA, the minister already said that they had given you all that you need, about 90% of your requests. So,
and like I said, all those proposals made by the other health workers that were achieved through the lawsuits or through law courts were reversed. That's what I'm trying to say. And you won't now say the Minister for Health is allowing all those happen. You get the point. There were a number of other things that I said. We're coming to the Ebola issue, which I was trying to talk about before we went on break the last time. Doctors and other health workers is about general health workers generally. The 5,000 naira is paid, as far as I know, to doctors as an allowance. And we were talking about this before this Ebola scare came.
85,000 naira.
5,000.
5,000.
1, 2, 3, 4, 5 is the hazard allowance
As of
per
today?
month. And there is no health insurance for you. In January, a colleague of mine who was pregnant then, she delivered in April. She was 5 months pregnant then, was trying to set a line for an HIV patient. She got pricked. And had to go through the trauma, psychological and physical trauma of taking antiretroviral drugs. We know how these drugs are nauseating. And then she was pregnant.
And all she got was 5,000 naira.
And that was all she's been getting since then. It's 5,000.
Just a minute. We have a last caller now from Ilupeju Babatunde. You have just 1 minute.
Can you hear me, please? Yes. Can you hear me?
Yes, we can. Please go ahead. You have just 1 minute, Babatunde.
1 minute.
Yes.
I'm not connecting you. Can I talk now?
Go ahead, please.
Okay, I will go ahead. I'm sorry to say this, to the compare, I have a very strong feeling. I'm not accusing you, but you seem to have a biased mind against the enemy man. I'm sorry to say this, and I will quickly elucidate why that is so. You keep on asking this question about the minister is doing this, and the young man has told you that, look, this thing does not happen anywhere. When you mention consultants, it is the people that the doctors are helping. Unfortunately, the doctors don't know how to do about it.
Okay.
If you have, let's say, in the court of law, you have so many people calling themselves judges. How is it going to look like? You won't even know who to call a judge. Let's talk about the aviation industry. You have captains of the industry. I mean, in the state, you have stewardess and all what's not. So if you now say the stewardess can be eventually become a captain, will you fly that plane? Will you fly in that plane? You see, what they are trying to say is that because of the health and advancement of Nigerians, people are not happy with their work. And what they want to do is to become what they are not. So that is the problem of the matter. Nobody is saying that the family should not do family. But the families in Nigeria want to be doctors. They put on stethoscope. They do all sorts of things in the chemist shop. The laboratory man wants to be doctors.
Sorry about today. I'm afraid that that's all I'll be able to take from today because of time. I'm so sorry. You said I was biased. I wasn't biased about today. I'm only doing my job. I have to make him stand on the toes to answer questions. That's my job, and it's just professional. Before I let you go, ASU was on strike for 6 months. ASUP 9 months. How many months are we looking forward to this enemy strike?
We actually
didn't
expect it to go this far. If government had actually given us opportunity to talk with them. As far back as 2-3 weeks ago, government has shut their doors to negotiations, despite the meager achievement we've had. Okay. And we've tried to let them understand that there are still things that we can achieve on this list of demands without actually having to go further. But it seems the minister, I think, is feeding the president with wrong information.
Okay.
That's based on what has been achieved, so far.
Dr. Segun Akinwotu is the second vice chairman of the Nigerian Medical Association, Lagos. Thank you very much, doctor, once again for coming. I wish I could shake you, but Ebola is here, but the doctors are still on strike.
There's Ebola
handshake. An Ebola handshake now. All right, we'll take a break now for the news of the hour, and Cold Digest will continue tomorrow. It's 8:30 in the morning. Thanks for being there.
You can now watch CORETV News live from anywhere in the world on our website www.coretvnews.com. Click on Live TV on our website and watch us live.
And welcome to CORETV Primetime Days.
To follow us on Twitter, click on Twitter icon on our website. And Facebook, click on the Facebook and YouTube to see all our previous news production. You can also watch us live on YouTube. Click CORETV, leave a space, then news. CORETV News, a 24-hour news station.